Live, the news on NBC6 starts now.
In the first week of easing kids back into the classroom in Miami-Dade County, in the district, we've seen some confirmed cases already of COVID-19. We've heard from the superintendent that contact tracing is part of containing those numbers. With us tonight is Dr. Fernando Mendoza, board-certified pediatric emergency medicine and founder and CEO of Scrivas. Dr. Fernando, thank you so much for being with us. Let's talk right now about the parents. You're a parent. I'm a parent. My kids are back for in-person learning. They have been. I know that the moment that a parent finds out about a positive case, we start to freak out a little bit. So what should parents be doing right now?
That's a great question, Roxy. I think, what parents have to realize is that if you're really engaged and invested with the way your school is going to deal and handle any symptomatic or COVID positive cases, that's the first and foremost thing. So, ensure your school and Miami-Dade County Public Schools are doing this, but your other schools, if you're in private schools, are really mitigating steps where, a good social distancing, mandatory mask wearing, hand washing, separation during lunchtime and things like that. And you have to also have a really proficient and accurate contact tracing program within their school just to mitigate any exposures to potential students and faculty.
What about our kids? Finding out that there's a positive case in our community, how do we talk to our children about that?
Well, first and foremost, we have to think about the kids, right? Most kids are not going to get really sick with COVID, but they can transmit it even asymptomatic with no symptoms to their parents or grandparents, whoever lives at home. But you don't want to make kids feel stigmatized. You don't want them to feel like they have a burden. So, we teach them about how to keep, proper distancing, continue to be isolated or quarantined if they're symptomatic or positive for COVID, and how to be around others, especially family members and other students. So the real important thing here is talk to your kids about what it takes to stay healthy: hand washing, mask wearing, and making sure you're honest about your symptoms.
And that conversation that is so critical to curbing the numbers here, contact tracing, the timing here, how important is that?
Immediately. It's really it's a very time-sensitive situation. The minute any child or faculty in a school setting or any other setting, whether you're a company or an employer or an employee, feel any kind of symptoms, whether you know it's COVID or not, it's important to tell the right people at your school, at the company, and that way you can identify, get the proper testing, the proper evaluation by your physician, whether it's a pediatrician or your general practitioner or an urgent care or ER. You can get the evaluation that you need to know if it's COVID or not.
Great advice. Dr. Fernando Mendoza, board-certified pediatric emergency medicine and founder and CEO of Scrivas. Thank you, as always, for your time and for your expertise. Great to see you again.
Thank you.